class we have completed till spreading of diseases we have covered, common human diseases we have covered, and bacterial diseases and resources chart we have done an overview. And from there 3 to 4 diseases you need to remember their causative agent, site of infection, mode of transmission and symptoms. You need to remember of three diseases of viral disease, bacterial disease and vector-borne diseases. And also we have discussed about Minamata disease. I'm going to revise that and I'm going to start from Itai disease. Minamata disease, also short from MD, is methyl mercury MEHG poisoning that occurred in humans who ingested fish and shellfish contaminated by MEHG discharged in wastewater from a chemical plant called Chiso Co. Limited. So, Minamata disease is caused by MEHG, which is methyl mercury poisoning, and it occurs in the humans who ingested the fish or the shellfish, the marine fishes means, that were contaminated by this MEHG. And how they were contaminated by this MEHG? By discharged in wastewater from chemical plant. And the chemical plant name, Japan chemical plant Chiso Co. Limited. So it was in May 1956, and Minamata disease was first officially discovered in Minamata city. Therefore, the name of Minamata disease came from there, Minamata city. So, the first time this disease was discovered officially in May 1956 in the city Minamata city in southwest region of Japan. So, where it was discovered May 1956 in southwest region of Japan in the Minamata city of the Kyushu Island. Kyushu, K is silent, so Kyushu Island of southwest Japan, Minamata city in 1956. The marine products in Minamata Bay displayed high levels of Hg concentration. So the marine products means the fishes and all, they from the Minamata Bay displayed high level of mercury concentration or contamination. Okay, nearly about 5.61 to 35.7 picometer. So it's a huge amount, 5.61 to 35.7 ppm. So this much amount of mercury was observed from the marine products. The Hg content in hair of patients, so the affected patient had a huge amount of Hg concentration in their hairs also. Their family and inhabitants of Shiranui Sea coastline, you no need to remember this name. The mercury content in hair of patients and their family also detected high level of Hg, maxed 705 ppm. So the fishes or the marine animals had a ppm of 5.61 to 35.7 and humans have max 705 ppm. So typically symptoms of Minamata diseases were serious disturbances like sensory disturbances, sensing problem, visual disturbance, constriction of visual, auditory disturbance, okay, and tremor were also seen. Fetus of pregnant mothers were poisoned by this MEHG by having the marine life. The symptoms of the patients were serious and extensive lesions of the brain were observed. So, the patients got serious after this Minamata disease and extensive lesions of the brain were observed. Okay, now we have Itai disease. So Itai disease, it hurts disease. Its full form is it hurts disease. Itai disease. Okay. Was the name given to the mass cadmium poisoning of Toyama Prefecture, Japan. So this disease, itai disease, it hurts disease, was the name given to the mass, huge cadmium poisoning, again in Toyama Prefecture, Japan. Okay, so that was in Yonshu Island, and this is in Toyama Prefecture, Japan. In 1912, the term itai disease was coined by locals for the severe pain. So it was termed the name so because of the severe pain which was caused by this disease. People with the condition felt in the spine and joint. So the pain was felt in the spines and the joints. Cadmium poisoning can also cause softening of the bones and kidney failure. So this cadmium poisoning causes the bone to soften. Okay, and kidney failure also. The cadmium was released into rivers by mining companies in the mountains, which were successfully sued for damage. So the mining companies, they without any knowledge, just released the waste into the rivers, which successfully sued for the damage. Okay, successfully caused the damage. Itai disease, also called it hurts disease, named because of the pain in the joint and the spine, also softened the bones and kidney failure, and happened in Toyama Prefecture, Japan. Okay, 1912. The Minamata was 1956, Yushu, Japan's Yushu Island, and this is Toyama Prefecture, 1912. This is also in Japan. Next, we have occupational health disorders. What are the occupational health disorder? Occupational disease, any illness associated with a particular occupation or industry. So, any kind of disease which you get because of association with any kind of industry or factory, then this is called occupational disease. Such disease result from a variety of biological, chemical, physical, and psychological factors that are present in the work environment. So this happens because of various biological, the chemical, physical, and psychological factors that you have in the work environment, or are otherwise encountered in the course of employment, or they can be encountered, discovered when the employment is encountered. Example: anthracosis, silicosis, fluorosis, blackfoot disease, asbestosis. So you can understand by the name silicosis because of silicon, fluorosis because of fluorine. So let's see what are they. Anthracosis is a type of generic term that is used to refer the blackening of the tissue. So anthracosis is a generic term which is used to refer to the blackening of the tissue. The tissues get blackened. The darkening black color of the tissue is due to excess carbon inside the lungs, and the darkening of the tissue is because of the excess carbon deposition, okay, in the lungs due to constant exposure to coal dust and the pollution. So, due to continuous exposure to coal dust and the pollution, it can be inhaled directly into lungs. Patients suffering from anthracosis gets carbon accumulated inside the lymph node. They also get carbon accumulated inside the lymph node. So, you can understand if someone is working in the coal industry, the coal dust gets deposited in the lungs, and they got this. It also get deposited in the lymph nodes. Next, we have silicosis. It is also a lung disease. It usually happens in jobs when you breathe in dust that contains silica. So when you breathe in the dust which is containing silicone, that's a tiny crystal found in sand, rock, or mineral ores like quartz. So that a teeny amount of crystal which are found in sand, rock, or mineral ores. Over time, silica can build up in your lungs and breathing passages that leads to scarring and makes it hard to breathe. So over time it gets deposited in the lungs and causes difficulties in breathing. So anthracis was carbon deposition, coal dust, and also pollution in the air. So in the lungs, blackening of the tissues, generic term for they get deposited inside the lungs, and also the lymph node. Silicosis is silica, basically exposure. There's small dust particles which are present in the rocks, present in the sand rock, mineral ores. Sand rock, mineral ores like what? Over time, silica can be built up in your lungs and breathing passages, scarcing and causing trouble in breathing. Fluorosis is a cosmetic condition that affects the teeth. Fluorosis is not of lungs, it affects your teeth. How? It caused by overexposure to fluoride during the first 8 years of life. So, when you get to overexposure to fluoride during the first 8 years of your life. This is the time when most permanent teeth are being formed. So when the most permanent teeth forms, like your milk teeth falls down and then you get the permanent teeth. So this time, first 8 years. After the teeth come in, the teeth of those affected by fluorosis may appear mildly discolored. So if you are exposed to fluoride, then your permanent teeth coming time means 1 to 8 years. Then after the teeth affected by fluorosis may occur mildly discolored. So your teeth will not be white or like that. It will be mildly discolored. Okay. Blackfoot disease. Blackfoot disease is a severe form of peripheral vascular disease. Blackfoot disease is severe form of peripheral vascular disease. Drinking arsenic rich water over a long period result in various health effects like changing color of skin cancer, etc. So Blackfoot disease is drinking arsenic rich water over a long period of time. So when you are having arsenic rich water over a long period of time, results in various health effects like changing color of skin cancer, etc. Absorption of arsenic through the skin is minimal. In China, exposure to arsenic via drinking water. Okay. Now, asbestosis. Asbestosis is a chronic lung disease caused by inhaling asbestos fibers. Okay, chronic lung disease. Prolonged exposure to this can cause lung tissue scarring and shortness of breath. So, lung tissue scarring and shortness of breath. Another disease which was causing lung tissue scarring was silicosis. Yes. Now we have sexually transmitted diseases, STD. So first is AIDS, acquired immune deficiency syndrome, STD, which damages the immune system of the body caused by HIV virus, human immunodeficiency virus, we know. So remember AIDS full from acquired immune deficiency syndrome, and STD, sexually transmitted diseases, damage immune system of the body and caused by HIV, human immunodeficiency virus. Now we'll start the disasters in the next class.